Hello Golden Hawks, and welcome to another PE video. I'm Mr. Vincent, and today we are going to be talking about your heart rate and how to take your pulse. First of all, there are two different types of heart rate that you should be interested in knowing. The first of those, as we briefly discussed this week, is your resting heart rate. Your resting heart rate is the heart rate that you would have when you are at rest or you are not doing any type of strenuous exercise. Your resting heart rate is going to be somewhere in the area of 70. It may be a little bit higher or a little bit lower. When you are looking at your resting heart rate, what you want to do is to exercise in order to drive that resting heart rate number down. That will ensure better cardiopulmonary health. The other type of pulse rate or heart rate that we are going to talk about today is target heart rate. And this is one that will be relevant to you when you're doing cardiovascular exercise. When we talk about target heart rate, that is the pulse rate that you will want to have, or the heart rate that you want to have during exercise or the end of exercise when you're doing cardiovascular exercises. A good target heart rate for someone of your age is going to be in the 100 to 170 max range. However, you're going to see probably your best gains in the 100 to 150 range, because the closer you're getting to the 170 range, the more difficult and strenuous the exercise is going to be, and the more difficult it is going to be to continue the exercise. One of the easiest ways to take your pulse is to take your pulse for a very short period of time, and then multiply that so that you get a general idea of what your heart rate is. Your heart rate is measured in beats per minute. However, if you stop to measure your heart rate for an entire minute, you're stopping your exercise for a very long time, and your heart rate is going to go down during that time. So I'm going to recommend using a shorter amount of time. Do remember, however, the shorter the amount of time, the more error there is, okay, or the wider range of error there could be. So the accuracy is going to be a little less, but it's going to give you a really good idea of what your pulse rate is and get you close enough. I'm going to recommend that you take your pulse rate for 6 seconds. That way you can easily multiply it by 10 by just adding a 0 to whatever count that you have, and you will be able to have a pretty good idea within about 10 heartbeats of what your heart rate is at that current moment. Now, when you are taking your pulse for 6 seconds, make sure that you are not just counting out loud to yourself to 6 seconds and trying to count your pulse. That is not going to be accurate at all. Instead, when you take your pulse, use some type of timing apparatus, like the clock on your iPad or a clock on the wall. There are two places that you would commonly take your pulse rate. The first is probably the easiest for most of us to feel, and that is your carotid artery. When you take your pulse at your carotid artery, you are going to find your carotid artery in this area of your neck. So it's going to be off to the side of your throat, about where you would see an Adam's apple. So it's going to be on the side of your neck. The easiest way to find that is to use your two fingers. Do not use your thumb, because your thumb actually has a pretty strong pulse and it may confuse your counting. So you're going to use your two fingers on the same side of the neck that you are trying to find the pulse. You're going to lay those flat across the neck to see if you can find the pulse. You may have to adjust up or down a little bit. Once you find the pulse, just hold it in that area. Usually it's very easy to find this pulse. And then you'll count that pulse for your 6 seconds. I'm going to do that on the counter on my screen. Okay, and my pulse I just completed was right at about 90, because I'm not exactly at rest. I am moving around and talking and doing this video. The other place that you can go to take a pulse that is also a very easy place to find is going to be on your wrist for your radial artery, okay? The radius is this bone here in your arm, and your radial artery is going to be just to the inside of that. So as you are looking at your wrist, you're going to, again, use your 2 fingers and feel to the inside of that, between the bone and the first large tendon. If you're able to find that, that's also an easy place to take your pulse. You would again count your pulse for 6 seconds. I'm going to do that now. All right, and again, my pulse was about the same as it was with the carotid artery, and it should be very close. When you are exercising, the best way to take your pulse is to just stop the exercising for a moment, quickly take your pulse, and get back to exercising. Now that you know how to take your pulse, use this during cardiovascular exercise to make sure that you are at the right intensity level. If you take your pulse and your pulse rate is around 90, you need to pick up the intensity a little bit in order to get the most effect out of your workout. If you find that your pulse rate is up around 170, you'll probably notice that you are getting out of breath very quickly, and it's very hard to continue on for a long period of time on your workout. So adjust your intensity accordingly. The lower your heart rate is, the more you can adjust your intensity up. If your heart rate is really, really high, adjust it down. Okay, just slow everything down a little bit. All right, and hopefully this will help you to be more effective at cardiovascular exercise. Now that you know how to take your pulse, do this along with your cardiovascular exercise today and practice that. And this will be your assignment for the Flipgrid on Friday. Now, get up and get moving and practice taking your pulse.